Hi, I'm Dr. Drew Schnitt. I'm a board-certified plastic surgeon certified by the American Board of Plastic Surgery. I'm also fellowship trained in craniofacial surgery.
The following video will demonstrate how we evaluate your baby for plagiocephaly and torticollis. To begin, I will ask you about your baby's medical history and birth history. Were there any problems during the pregnancy? Was your baby carried to full term? During delivery, did everything go well? If not, we will need to discuss this further, as some details may give insight into the problem your baby is currently experiencing. Next, I will check on your baby's general health. I examine the skull and ask if there are specific issues that prompted you to seek an appointment. I will then measure your baby's skull in all directions. In this case, the head dimensions are normal. Normal measurements do not necessarily mean the absence of plagiocephaly. Plagiocephaly refers to the abnormal shape of the cranium or skull. Other anatomical features may also be affected, such as the temporomandibular joint, the orbit or eye socket, and the cheekbones. I will also check the fontanelle or the soft spot to make sure that it is still open. This may have an effect on your baby's head growth. The forehead may be shifted forward, which is evident in this patient, where you can see the right side is shifted forward and is more prominent. Additionally, you can also see that the eye socket, cheekbone, and the temporomandibular joint are all shifted forward on the right side in this patient. Conversely, the left side looks like it is shifted backwards, and the back of the baby's head is flat. This is called deformational plagiocephaly, the medical term for flatness of the head. From my clinical examination, I can tell this baby does not have abnormal fusion of the skull bones. The diagnosis of plagiocephaly may be made by an expert purely on clinical grounds. No further radiologic testing is required, such as an X-ray or a CAT scan. These studies are reserved for more severe conditions such as craniosynostosis or premature fusion of the skull bones or other cranial abnormalities. Now I will show you some exercises that you can do at home with your baby to help improve their condition. These include positioning techniques to help your baby off the flattened side of the head. The goal is to position your baby so that the flat side does not make contact with the surface where they sleep or rest. This can be done by slightly elevating one side of the mattress. Whatever technique you choose to use to elevate one side of the mattress, do not use anything that can cover your baby's face. When the baby is not sleeping, I recommend using seats like this. They help keep your baby upright and keep the head from making contact with any surface. As a warning, never put your baby in a seat such as a bumbo seat on an elevated surface such as a table or countertop, as your baby may fall and suffer significant injury or even death. It is important to keep your baby upright as much as possible. Therefore, limit your baby's time in car seats, strollers, and on any device where their head is contacting a surface. When your baby is able to sit up by themselves, this sitting position is very good for treating plagiocephaly. In more severe cases, I recommend the use of a cranial molding orthotic, commonly referred to as a helmet. The best time to decide on the use of a helmet is when the baby is approaching 6 months of age. If a helmet is fit prior to 6 months, it is common for the baby to grow out of the helmet and require a second helmet for treatment. If the baby is fit much after 6 months, the use of the helmet is not as effective as the baby approaches 1 year. Helmets do not seem to have much effect at all as the baby approaches 18 months of age. Plagiocephaly is commonly found together with torticollis. Torticollis is the medical term for tightening or foreshortening of the muscles of the neck. A simple evaluation may determine whether your baby has torticollis. Torticollis may be a congenital condition occurring in the womb or may occur after birth. To check your baby's neck range of motion, I will use an object to attract their attention to one side or the other. By moving it left and then right, I can see how the baby reacts. In this case, notice how the baby arches his whole body and tilts his head backwards when he looks to the left. This indicates that his neck is stiff on one side. Next, I feel the baby's neck muscles to see if there is tightness on one or both sides. There are stretching exercises specifically for babies that have torticollis. Outpatient therapy alone is not enough to correct torticollis. These exercises must be performed at home on a regular basis in order to achieve the desired result. The exercises are very simple and should be performed with every diaper change or about 6 times per day. It is important to see an outpatient therapist to confirm that you are doing the exercises properly. Babies do not like to be restrained, but we do have to hold them down temporarily to perform the exercises. To perform these exercises, we hold one shoulder on the table so it does not elevate. With the other hand going across the side of the baby's face, we direct the face in the opposite direction for a count of 10. We do the same thing going in the other direction for another count of 10. With the next exercise, you sometimes have to lean across your baby to keep the baby from moving, and using the other hand, you come over the top of his head and gently bend his head towards the shoulder for a count of 10. This should be repeated on the other side as well. Another effective way to stretch neck muscles is by changing the way you carry your baby. Start by facing the baby away from you and placing one arm at the elbow underneath the baby's rear end. Place the other arm under the ear, also at the level of the elbow. Now, let the weight of the baby drop down while elevating the elbow under the ear. As you can see, the opposite ear touches the shoulder, mimicking the exercises demonstrated earlier. This is one way to do continuous therapy. Techniques may also be used to have your baby voluntarily stretch their own neck muscles. For instance, by introducing a bottle or toys to your baby's far right or far left extreme, the baby will follow these objects, thereby voluntarily stretching the muscles on their own. Remember to always place the bumbo seat on the floor. Never place it on a table or countertop, as your baby could fall and this could cause serious injury or even death. Positioning your baby in a manner in which they must stretch their neck to one extreme or the other in order to see you will also facilitate neck stretching. It is important to perform torticollis therapy or neck stretching exercises on both sides of the neck. If one side is neglected, the opposite side may suffer from stiffness or torticollis. We have created this video in order to facilitate your understanding of the evaluation, diagnosis, and treatment of plagiocephaly and torticollis. It is important to have your child treated by a board-certified, fellowship-trained craniofacial plastic surgeon to ensure that your child does not have craniosynostosis or premature fusion of the skull bones. Craniosynostosis is treated surgically, whereas plagiocephaly is treated non-surgically. It is also very important to understand that not all helmets or cranial molding orthoses have the same efficacy. The fitting of the helmet or orthosis and subsequent adjustments are paramount in achieving the desired result. We hope that this video has been informative and will help you in your baby's treatment course.
Thank you for watching this introduction to an office visit for a patient with plagiocephaly and torticollis.